Thank you very much for joining this Q&A immediately after the Lincoln Talent Academy. I've managed to, well, Somaya suggested it really, so Samaya's obviously going to stay. Somaya, do you want to introduce yourself to the people on this call just because, or the people that watch this video, because they may not have seen the call and they may not know as a result?
So hi, I'm Somaya and I'm a first year medical student at Holyoke Medical School. I'm doing the 6-year MBBS course.
And what is the 6 year? Because that was one of the questions that we got, wasn't it?
So the 6-year course, the difference between that and the 5th-year course is that's like a foundation. So you do kind of recap A-levels. Again, you use some clinical content into it, but it really gets you into what medicine is going to be like for the rest of the course length. And also, you cover things that you may not cover in first year. So, for example, essay writing, you get more guidance, basically.
Brilliant. So the first question that we got from the list was, are there any books you would recommend reading before applying to medical school?
I personally didn't read any books really before applying, but I did watch a lot of YouTube videos. One channel that I may recommend is Ali Abdal. I used his videos for interview questions and how medicine is really.
Brilliant. Okay.
Do you ever regret doing medicine?
No, not at all.
Do you miss working in the NHS?
100%. Definitely. And I'd put it this way, I wouldn't rule out one day going back. I don't know in what capacity. I don't know in what guise. I mean, I'm incredibly fortunate. My NHS work, not that it's paid, is essentially with you lot. You unruly rabble, which you're not. You're great, really. But yeah, my mentoring and my not even mentoring, it's the formal honorary lecturer role with Hull York Medical School. That is enough of an impact in terms of on the front line, because yes, it's a bit of a slow burn and it's not that one-to-one patient contact that I got in the NHS, but I do still get that in the clinical work that I do elsewhere. But it's my role as an honorary lecturer teaching you all, and right at the formative stages of your career. That's enough for now, given the other bits that I'm very fortunate to be able to be doing now. Do you think work experience needs to be clinical?
I know of many medical students that didn't do clinical. They did a lot of care home or community centres. But again, that depends on the uni. So I can't speak for every uni because some universities will require you to have clinical placement. But a lot of them don't. I think the thing with a lot of them is you just need to learn the skills. And whichever work experience it is in, just learn the basic skills of a successful doctor. Communication, teamwork, leadership, etc.
Okay, very good answer. I'll ask you first. How do you deal with the lack of motivation? And then I can do it.
The thing with me, I don't wait for motivation because that's not gonna get me anywhere. The
What?
thing,
What do you mean you don't wait for motivation?
no, because if you wait for motivation for that thing, it's not. There's many days that you won't have it. So starting at something will give you motivation. That's how you get motivation. It's not that you don't use motivation. It's starting doing something. For example, studying. Sit down at your desk. Do anything and the motivation will just come. But if you wait to be motivated, just sit at the desk. That's not.
Yeah, that's a really good point, Samaya. And I think there's if I were to, that's a better answer than I'd give, to be honest. I don't know what I'd give a waffly answer. So, what you are also talking about though is the theory of marginal gains. And the theory of marginal gains is something that Sir Dave Brailsford implemented at Team Sky, which is obviously a world-class cycling outfit. And that was, if you can be, Ali's done a video about this as well, in terms of if you can become 1% better about something every day, it's almost not noticeable on that day, maybe even that week, that month. But if you look at it over a year, and then 5 years, and then 10 years, continually getting that little bit better, then you can start getting exponential growth in terms of performance. So that's really important. So, sorry, go
Somebody
on.
just asked if Pathways to Medicine counts as a fourth choice. This isn't actually a course in terms of on your UCAS application. This is something separate that you apply to through Hull York Medical School. And alongside to that, there's other programs they do. For example, Realizing Opportunities, which I also did, and WAMS with Leeds. So those don't count as your choices.
Sorry,
They're
talk
just
about those a bit. They sound like they deserve a bit of a shout out. So what were those two things called?
So Realizing Opportunities is basically you either write an EPQ or academic assignment. That's a piece of research that you do and an essay. I think it's 4,000 words. I'm not sure. I forgot. It was some time ago that I did it. But basically what they do is they give, Realizing Opportunities give a grade reduction, 2 grade reductions, I think, for some universities. Is the process of applying for masters similar to that of applying to university for an undergraduate?
Yes and no. I the two masters that I applied for were slightly different in the sense that they came with a job. So I did a clinical teaching fellow job, and as part of that, they would pay for a master's with Nottingham. So the first one was the medical education one, the second one was the MBA. I think that there's lots of paperwork. That different universities will have different selection criteria. There'll be interviews for some. There'll be other ones that won't have interviews. So I think it's quite a mixed bag, really, in the same way that all the medical schools are a completely mixed bag with regards to grades and work experience. So for the audience that are watching on this, my biggest bit of advice is to make sure that you do your homework. You thoroughly research wherever you want to apply to, whether it be undergraduate, postgraduate studies, and you tailor your application as much as you can to that individual place.
Yeah. So how long roughly do you need to spend in university to become a doctor?
So, how long do I need to spend in university to become a doctor? It depends. Again, it can be 4 years if you've done something before and you can do a graduate course. It can be 5 years if you do the undergraduate course. It could be 6 years if you're doing something like you're doing with a gateway year. And it could be 7 years if you're unfortunate enough to fail a year or you have to take some time out. It could be, so it's anywhere from 4 to 7 years, say. There is some requirement from the GMC that you have to complete medical school training. I think it's within 7 or 8 years. But it is a significant and substantial portion of your life to commit and to dedicate to it.
So, which sector did you enjoy the most in the hospital?
Well, obviously for me it was surgery. I loved it, but I couldn't get the exams. Couldn't pass member of Royal College of Surgeons, and my career stopped at that point. But that's not a bad thing or a sad thing for me, in the sense that the skills that I learned I still use today. When I work clinically in urgent care, if I need to suture a wound, or when I used to work in A&E a lot, if I needed to suture a wound, it was fine. All the orthopedic skills that I learned from history, examination, and basic treatment point of view, I still use. So it's a case of continual learning. I think you said on the Talent Academy call, it's a case of continual learning and making sure that you take skills from one area and build them onto the next, whatever that may be in your career. What is the difference between a 5-year and a 6-year course? Is it the content or entry requirements?
Entry requirements, and content. So entry requirements they tend to be Bs rather than the 3As.
Okay.
Or ABB, etc. But the content, in terms of, again, you recapping that A level, perhaps any knowledge that you may have missed during your actual A levels, and again, working on those fundamentals, essay writing, presentation, things that you won't actually go through in first year.
Okay, brilliant, very good. What is your LinkedIn profile, Somaya?
I don't have one, but
what?
I do use Instagram. I don't know. I don't have one.
Okay.
I'll make one today.
I think that's sensible. But you're gonna provide your Instagram profile to them, so that's good.
Yeah.
What type of medical jobs would you recommend? That was you gonna ask to me. So I don't know. What do you want to do? What kind of medical job do you want to do? And then I'll answer your question that I asked myself.
I'm gonna be careful what I say, because in 6 years' time, if I look back.
Okay, so it's a long time. So I think, listen. Okay, go on. It doesn't matter. I mean, nobody's going to hold you to this.
Yeah, so far A&E really stands out to me.
So I loved A&E as well. And then what type of medical jobs would I recommend? I think it would be A&E I loved, surgery I loved. I love what I'm doing now. I, I think it's more the art of practicing medicine rather than the job that you're going to be doing per se. Because also, Somaya, it's right. While in 6 years' time, you might look back and it might be a very different landscape. But equally, in 10, 20, 30 years moving forward, the practice of medicine is going to change. And what I would say, it's the core fundamentals of communication, human intelligence, or sorry, emotional intelligence, human empathy, that level of connection between doctor and patient is going to be even more important when computers are doing a lot of the work. So the explanation of why the computer has come to the decision that it has, I think that kind of future gazing is vital. And I think the skills that you're going to be getting, not just on this year but the next 5-6 years of your training, are going to be absolutely vital. So I think that's that. So before we finish, have you got any comments? Have you got any thoughts? What was your thought of the call today that we had with Links Talent Academy?
I think if I was in the position that the students that are watching were in today, I think that would benefit me a lot, because people, especially medical students that I came across, don't really talk about where they failed, because it's quite a stigma. You know, you want to be that, you want to show yourself, especially medicine is such a competitive environment. And going into it, I think in one of the lectures we mentioned this. So in A levels, it's like competition, competition, competition. And then all of a sudden, you get into medicine, you're still competitive, even though you're not really supposed to be, because you're all working for the same degree, but you still got that competitive nature in you. And I think that kind of puts you off a bit of what your goal is, because you want to be the best. I went off the tangent. I don't know.
No. So listen, what I would say to you on that comment is I completely agree in terms of the competitive nature of medical school is not great, in terms of you take big fish in not even ponds but puddles, and then you put those big fish into an ocean, and then suddenly there can, depending on the medical school and depending on the culture, but there can be an issue where it's really competitive, ultra competitive. And then that continues throughout foundation training, core surgical training, higher training, consultant life. And unless you're careful, the whole career can be super competitive. Now, it's about having more of a caring, compassionate approach to clinical practice. And I think that starts in medical school. And certainly what I've seen, well, I can only comment on the students that I'm engaged with at the moment. And as a group at Hull York Medical School, the 32 or the 36 students that I've got the privilege to teach on the Gateway program or the medical scholarship module, or all that kind of group that we've got, that WhatsApp group, none of those behaviours are there. And that's why you're an absolute pleasure to teach. And that's why I will spend my Saturday morning doing stuff like this, to open up opportunity for you and others on the course, in terms of if they say they'd like to do something and it just so happens that I'm doing it, then of course we can incorporate you guys, right? So
And
so
yeah,
go on.
I think it's really beneficial to share where you went wrong, where you had your dips, because you're clearly showing that you went through it, you passed it, you overcome it. It's okay to fail, like you said, that's a big thing. And I think once you understand that, because obviously a medical student has its stereotypes, you know, you have to be super intelligent, you have to get A's all along, A stars, but there is no conversation about what happens if you dip. So I think today's session was really beneficial in those terms.
Fantastic. So you've got a couple of minutes to close then, Somaya. Tell us all about your work experience in Palestine. That sounds amazing.
So in April 2019, I did a week of work experience in A&E in Palestine, and I've seen a lot. I got to take blood. I got to insert a cannula. It was guided and observed by a nurse, but I think that experience really showed me how unpredictable medicine is. You don't know what's coming through the door. You don't know how the patients are going to act. You don't know what's wrong with them. There's a lot of aspects that come into it. And you have to be really skilled in adapting to a diverse range of situations. So I came across angry prisoners. I came across someone going through a pain episode that suffered with sickle cell anemia. I went through the maternity ward where I heard women scream. I've even experienced patient death and seen how the doctor delivers that message to the family and seen them break. So I feel like that was really beneficial because it really solidified that passion that I had for medicine, and it made me want to do it.
Brilliant.
Yeah.
Well done, Samara. I mean, I think that shines through in what you do and the interactions that I've had over the last few weeks with you, and I think it sets you up in really good stead for the rest of your career. So well done for today. I look
Thank you.
forward to doing more of these with you. I think we probably will, and enjoy the rest of your weekend.